A room full of throat cancer survivors in Hong Kong. They're relearning essential everyday phrases. Each has lost his larynx or voice box to cancer and then to surgery. These plastic tubes are the first step on their journey back from silence. Sammy Cheng is the new Voice Club senior instructor. He lost his larynx 15 years ago. He knows all too well the fear, the anxiety that newer patients face.
Usually, laryngectomy survivors are very scared. They're not sure how well they will recover. But we are fully recovered, and we can tell them what we've been through.
It's this man's first day at Hong Kong's new Voice Club. It's a frustrating first attempt. There's a trick to getting the right amount of air through the plastic tube at the right time. Luckily, his neighbour is supportive and encouraging. And he's been using the device himself for years. Ng Ah Choi is here with his son for a checkup with the new Voice Club's doctor. 1 year ago, he started sounding hoarse and began spitting up blood. Doctors diagnosed the cancerous tumour immediately. They removed the tumour and with it, his larynx. Surgeons left a hole in his neck for him to breathe through. Today, the doctor checks that tracheal hole for signs of swelling, and he inserts a fibre optic scope into Mr. Ng's nostril, checking inside his throat for signs of more cancer. So far, so good. At the end of the meeting, a decision needs to be made as to which of the speech devices best suits Mr. Ng. It's often a question of the patient's personal preference. Most cancer survivors start with a plastic tube, also called a pneumatic artificial larynx. They are the easiest to use, but they need frequent clearing and cleaning. Other patients choose tracheoesophageal speech. No device is necessary, but the patient has to plug his trachea hole with a finger when he wants to speak. Mr. Ng has chosen this electric device, and Sammy Cheng will show him how. Called electrolaryngeal speech, the buzzer sends vibrations through the neck and turns them into sound. For many laryngectomy patients, the goal is to speak like Sammy Cheng, without using his hands or a device. It's taken him 15 years of practice.
At the beginning, I was very depressed. But later, I thought about the blind and the deaf. They manage to live normally, so I can live without a voice.
That kind of positive thinking is vital to learning new speech, but so hard to come by in the first days after a larynx removal. Leong To has just had a cancerous throat tumour removed. He's mute and nervous about the future. Sammy Cheng, a social worker, and other survivors are here to reassure Leong To that, like them, he will one day speak again. Dr. Ng Weiman is a plastic surgeon specialising in throat surgery. He deals with the physical side, but thinks the new Voice Club's emotional support is vital to new patients.
At the beginning, most of the patients cannot accept they've lost their voices. They feel very helpless. The new Voice Club is a huge help to us in comforting the patients, both before and after surgery.
Mr. Ng remembers how much he was cheered by the first hospital visit from the new Voice Club.
Everyone at the New Voice Club has been so very nice. I'm especially grateful because they've taught me to speak again.
Lunchtime, and the New Voice Club is enjoying dim sum. It's a chance for newer members like Mr. Ng to practice their newfound speech and to enjoy the bonds of friendship formed through a shared experience.